Hi, my name is Brady Stein. I'm a hematologist at the Northwestern University Feinberg School of Medicine in Chicago, Illinois. And I'm happy to share some of the results from our abstract presentation at this year's ASH annual meeting. And one of the questions we've been asked has to do with the most common cause of mortality or common causes of mortality for patients with polycythemia vera. So our study included a cohort of over 2,500 patients that were followed prospectively. Most of the patients were treated at community hematology oncology practices, a smaller fraction at academic centers. This is part of a cohort study that will hopefully address many questions for patients with polycythemia vera. This particular analysis looks at the question of mortality and causes of death. And the summary points that we found were that, one, about 10% of the cohort passed away during study follow-up, which is about 3.5 years. And when we looked at the characteristics of the patients who died, their distinguishing features were that they were older at their diagnosis, and they were more likely to fall into a higher risk category of polycythemia vera. And PV patients who are higher risk are typically older than 60 or with a thrombotic event. In our cohort, there was an overrepresentation of higher risk patients who died, and this was mostly by virtue of age. So that's a very consistent finding across many studies in polycythemia vera. Many of the large natural history studies identify the impact of older age and a prior thrombotic event as contributing to mortality. When we looked at specific causes of death, in keeping with many of the large cohort studies, most of which have been retrospective in the past, the most common complications or most common causes of death were due to vascular complications. That was about a third of patients. This was a diverse category. We had patients who died from heart failure. We had a group that had cardiac arrest, patients with myocardial infarction, to a lesser extent, patients dying from venous thromboembolism. The second category had to do with hematologic transformation. So this is, of course, a clear issue for patients with long-standing polycythemia vera. And so about 15% of patients died from a hematologic transformation. This was most commonly due to acute leukemia. We had about 12% who died from solid tumors, and that's an association that's known, an association between PV and the development of a solid tumor malignancy. Those were the most common causes. We also had a proportion of patients who died from respiratory failure. Now, some of that may be explained. There were patients who had perhaps smoking-related lung disease, but there were other patients who died of hypoxemic respiratory failure, for which the cause was at least not known to us yet as the investigators. And this has to be explored further, especially because there's a concept of associating MPN, such as polycythemia vera, and pulmonary hypertension. So that's something that we would like to explore, that's hypothesis generating. So that's a summary of some of the major findings from our ASH abstract, and I thank you again for listening.